Okay, hello and welcome back to Check Up with Bluegrass, the official podcast of Bluegrass Community Hospital. I'm Dave Stites, CEO of the hospital, and your host for the monthly series as we sit down with the incredible people who help bring compassionate, high-quality care to our neighbors here right in Woodford County. If you caught our first episode, thanks for joining us. If this is your first time tuning in, we're glad you're here. Our goal is to offer kind of behind-the-scenes looks at what happens in our community, in the hospital here, and share some valuable health information at the same time, straight from our team of experts. Today, I'm honored to be joined by three outstanding guests. First, Dr. Brandon Haake, our medical director of our emergency room here. And next, Jamie Stamper, our Director of Emergency Room Nursing, and Freemen Bailey, Director of Woodford County Emergency Management Services. And together, they'll help us understand how emergency care works here in our county and what we're doing to continually raise the bar and how the community plays a role in it all. So let's get started. Dr. Haake, thanks for joining us here. And
Thanks,
if you just give me a little bit about your background and what led you to emergency medicine.
Sure. Well, I grew up in Illinois, so I'm not a Kentucky native, but I have been here for 20 years, so I kind of consider myself now. But I went to University of Illinois Med School. When I was doing my tour of all the different residencies and where I thought I would go, Kentucky was like my last stop. University of Kentucky was my last stop. I did have an aunt and uncle that lived here, and I went to visit them. They took me out, kind of met some people, showed me the town, and it just hit me immediately how nice and comforting Southern hospitality, I guess, at its best. So it just felt completely right for me to start or basically come to Lexington. My plan was to do primary care with like a sports medicine emphasis when I started. Back in the day, this has been 20 some years ago, as a resident, they let you do moonlighting in very small ERs, and basically you do a whole weekend, like 48-hour shifts. Mm-hmm. And so I was doing that for extra money, just trying to, pay the bills at the time.
Right.
And I just fell in love with ER. It just was what I felt I wanted to do at the time. So changed my course, basically. Since then, just all I've done is work in ER. And another thing about this area is I'm really into horse racing and sports of all kind and outdoor activities, and I don't think there's a better location I could be than the Lexington area for all those things.
You can't help but be into horses here in central
right,
Kentucky.
Exactly.
So what makes the ER of Bluegrass unique?
Oh, that's actually a great question. And I've worked dozens of ERs across the state. One thing that I love about it here is that we really don't have a lot of turnover in either staff or the doctors. And I really think that's because we all enjoy working together. It's just a great environment. We have dinners together. We text each other on off days and things like that, and it's just the morale is really high here in our ER versus other places that I've worked, and I think the patients actually sense that. It's just a positive working environment, and that's why we always get good review scores because of that. So for its uniqueness, I would definitely say that's probably the one thing.
Yeah. So one of the things that I think is really unique about the Bluegrass ER is how we collaborate with our local EMS. And just give us kind of a sense of how that works for, the people that work in the ER as well as with the EMS
Sure.
itself.
Yeah, we have a very good relationship, as Freeman will explain here later, with the local EMS. Freeman and I and Kent, we all, we text frequently or even have our own little meetings frequently, kind of address our problems. So that's, some things that we can get ahead of for sure. We also have been having these joint meetings or collaborations, semi-regularly, where an ER doc will go over to to the EMS station, and there's some education involved, but a lot of it's just kind of getting to know everybody. And the other thing is, one thing at least for myself, but showing appreciation for them when they come in the door. Don't act like they're burdening us, things like that. And it's just a mutual respect type of deal. And I think that we have a strong positivity with that. So, and that again reflects on patient care.
Yeah, you feel the same way?
I do feel the same way. We're able to talk straight with the docs and with the nurses. The crews come in and they'll show their respect to each other. Our crews get along great with all the docs when they bring in patients, and it's just there's no conflicts. We don't have to worry if there's something that goes wrong. One of our crew is on an off day, we discuss it, we work through it, and same thing with the nurses, and we're all here for the right reason. That's take care of the patients, get the best outcome for the patients, and
Right.
having a hospital is a huge benefit.
Well, I will say, out of all the hospitals I've been in, this is probably the first hospital where I knew the director of EMS by their first name. I mean, because you're always here, and it's great to have that kind of collaboration and that teamwork and the sense of community that brings with it. Jamie.
Yes.
So we see about 8,000 patients a year, and that's makes a big role for you in the ER as the director of nursing down there. So,
Absolutely.
Describe your role there and what a typical day in the ER is like for you.
So
If typical is possible.
Yeah, typical is not a word we use. But as nursing director of the ER, I'm kind of the one that gets stuff done. So if something's broken, if we're out of something, if anybody's having an issue, I'm kind of the one they go to, and I will get it done.
And make sure we're staffed.
Exactly. keep nurses, keep my nurses happy is a
Right.
big piece of that. But as a typical day in the ER, there is no typical day. The typical day is unpredictable. It is a variety of patients, fast-paced. Have to have teamwork, definitely. The nurses and the doctors sit really close together. It's kind of a collaborative approach to patient care. So, yeah, you just never know what is going to walk in the door, and I think that is why people choose emergency medicine, just because it's not a typical day. You never know what the day is going to be like.
Right. No 2 days are the same, are
No.
they? So we have several accreditations here at Bluegrass. Talk about the ones that are important to you that you tend to focus on the most.
So we are chest pain accredited. If you come in with chest pain, we do an EKG in less than 10 minutes. The doctor sees it in less than 10 minutes. If you are having a STEMI, our goal is to get you out in 30 minutes or less, and we are pretty good at getting that goal. We are also SANE ready, so if you come in and need a exam for sexual assault, we have somebody on call 24/7. They come, they bring a patient advocate. So all of the forensic things involved with that, we have somebody that can come anytime, any day, and take care of you in that sense. We are also acute stroke ready, which we've just received recently and we're excited about. We are using the technology of Viz AI. We work with UK. So if you come in with any symptoms, slurred speech, weakness, dizziness, we will get you into the CT immediately. And then those images are pushed to Viz, which is an AI, FDA-approved AI technology that will look at those images and give you a efficient diagnosis. They get a hold of the UK neurologist immediately. The doctors have, chat with them real time so we can get the patient to UK if necessary, if that is the plan of care.
Yeah, we kind of talked about artificial intelligence on the last podcast that we had. We use it in the GI lab for endoscopies, and AI in the ER is just so interesting. The way you can put it on the CT scanner and it can find these occlusions much quicker than, the physicians can find it when they're looking at it. So it's just a really cool technology, I think, that we use here.
And there is still a doctor that sees it. It just kind of, if there's anything that's like a red flag, then it can get it to the doctor like, hey, you need to look at this right now, as
Right.
opposed to in line, if there's, 10 scans that they need to look at, it kind of puts it at the top of the list like, hey, you need to look at this one now.
Right,
So.
exactly. So Freeman, we're glad you're here this morning. So tell us about the role of the Woodford County EMS and how you support the community and what you do for the community here.
Thank you, Dave, for having. The role for Woodford County EMS in our community is we feel that we work for that community. We're a part of that community. A lot of my staff live here. We're a part of it, and we're a hands-on type of agency. We do a lot of special events with the community. We do a kids safety fair with our community and we incorporate every emergency service, hospitals, nurse, we have everybody there with that to where we can get out and show the community what we have to offer, what our community has. Because we look at it as a team. So Woodford EMS is not just a standalone by itself EMS. We look at it as our hospital is part of that team, our health department is part of that team, our fire departments, police departments, and all of our jobs is to keep our community safe. So we work hard to do that.
One of the things that I think is really fun that we do together are some of these community events. And I know recently we had, the hands-only CPR stuff at the school, and talk a little bit about how you guys get involved in that and how you involve us. We appreciate you.
Absolutely. We started that program a few years back, and we wanted to get as many people out there in the community trained on CPR, how to make a difference, because we all know that as good as our doctors are, as good as our paramedics are, that time is the most important thing. And so when a person goes down, having the community out there reacting and responding and doing the CPR is very important. We've had, each time we've done it, it seems like it's grown. Yeah. We've had extra people come in. We still had over 100 people come to the last one, and that was during the severe storms.
Right.
And rain. But they still came out. They braved the weather and came in. They brought, we had age groups from anywhere from a 5-year-old to, an 85-year-old that came in to do the CPR with us and to participate with that. We work extremely well with our groups throughout, and our Chamber of Commerce. Emily Downey helps coordinate and put this stuff together with us. And again, Jamie and the health department, our police departments, fire departments, everybody was there to contribute at that event. So it gives you the opportunity to see that how collaborative we are together with everybody, and our community is one. As Dr. Haake made the comment, it's there's no lines drawn in the sand. We all need each other to survive.
Yeah. So one of the things that, that somebody out there might be thinking about is, as a resident, when should I call EMS and how do I get a hold of them? Is, what's the best way if I'm having an emergency? What's the best way to contact
Our biggest
them?
thing is we want them to dial 911 for any emergency that they're having, especially if it's a chest pain or they think there's a possibility of a stroke, anything like that. That's very time sensitive. Our crews are very well equipped to be able to respond to that and determine if this is something that's going to have to go to a cath lab or immediate CT to where they can do the things they do. So they go in and we do that. We can get them in quicker. We can start treatment on the way to the hospital with that. So it's very important that they understand that that's the big things there. We get every type of call you can think of
I'll bet.
for calls for service, everything from somebody having a true cardiac event to somebody that just stubbed toe. Our big thing is sometimes, you got to remember to treat the personal and the mental side of the patients. Some of them are, they may not always have that emergency, but they can have that emergency.
Right.
So every time they call, we're going to respond. We're going to be there for them.
And Jamie and Dr. Haake, you guys see the same thing in the ER. I mean, when somebody comes in, to you it may not seem like it's that big of a deal, but to them it's an emergency.
Well, people will come in all the time and be like, I'm sorry I came in. And we're like, if you think you need to be here, then you need to be here.
Right, exactly.
So,
And you never know, because, that
Absolutely.
one could turn into something
it's usually the
significant.
walk-ins that are, the true emergencies. So,
Right, exactly. Let's see here. So 911's a big deal, and do you feel like we've gotten the word out on 911? Everybody knows.
We do. We've gotten a really good response to the 911. We get plenty of calls. We average over 4,000 calls a year. And like everybody else, we compare it to like fire departments and stuff like that. Not every 911 call is a true life-threatening emergency. It's an emergency for that person at the moment that's calling. And a lot of times it's
Exactly.
just talking to them, listening to them, and communicating with them, and then they understand a little better, well, I could have probably went by car. But some people, it's just they're alone, they're scared that moment, and with the internet out there, they can Google their symptoms, and
Right.
Lord knows what comes up with that.
Exactly.
So
yeah.
it's going in, just talking to them and reevaluating and talking to them, making sure they understand what's there. And then we've got excellent doctors and nurses at this hospital right here at Bluegrass Hospital. They have that small town mentality, a lot of them, and we have to educate them on that's not what it is. That these doctors work in the big hospitals too. They work at Central Baptist, St. Joe, UK. They've been there, they've done it, they've been at bigger hospitals. They're coming in here because they like our community. They want to be a part of what we have to offer. And that's where we educate them out there that, hey, they can handle this. Let's go over there and let them take care of you.
Well, chest pain in Versailles is the same as chest pain in Lexington.
Exactly.
So, you treat it the same way, and we treat it here just the same as everywhere else. So, Dr. Haake, what are some of the biggest misconceptions about emergency services?
Well, that's a good question.
I stumped them.
A lot of times they touched on one thing that everyone thinks that we're so busy. They apologize. They'll come in and say, I'm sorry for taking up your time. No, that's completely acceptable. A lot of chest pains that we see, and then they end up having, heart attacks. So we're happy that they come in for those reasons. I'm not sure if I can't think of any misconceptions off the top of my head, but.
Well, I know a lot of people have trouble getting into their primary care. It's months out. So we can kind of see them, and we can actually get them a follow-up appointment with any specialty before they leave. And that has been really helpful, because if you just give them the number to call, they might call once. If they don't get through to anybody, then they're not going to even try again. So the fact that we can get them an appointment, time and date, pretty much like within the next week, they really appreciate that.
Yeah, that's a
point,
big
Jimmy.
plus for the services that we offer here. So as we head into the summer months and the nicer weather, what can people do to keep themselves out of the ER and away from EMS services?
Well, there is one of the biggest things we tell people to do is during the summer months, because it gets hot, is to hydrate yourself. And understanding what it means to hydrate. That doesn't mean you wake up that morning and start drinking water for a half an hour, you drink a couple cups, and then you're good to go. Is they have to start, days before they're going to be doing something strenuous outside. A lot of our elderly people, we get them during the summertime that are overheated quite well, because they want to get out and work in their flower beds and work in their yards, and they don't realize the heat. They don't register the heat the same as a younger person.
Yeah.
So that we get that a lot. So educating them on how to hydrate and how to make sure they wear like their sun hats and things like that helps them stay out of the ERs with that.
And what about the weekend warriors out there?
Well, definitely kids need to, bike helmets for any kind of,
That's a
roller
great-
skating,
great point,
scooter.
yeah.
We do see a lot of kids in the
Alcohol
summertime.
in moderation.
Yeah, that's big.
Yeah.
It's like hold my beer.
Yes.
It's like all right, but and that's the river. the lakes. You know, we always tell them alcohol and water don't really mix.
Right.
Because, you know, sometimes when you drink a little too much, like Doc says, your judgment is not as clear as it should be. And so we get injuries off of that as well, things like that. But that's one thing they can do.
Well, good deal. Well, any final thoughts from the three of you? You guys, it's been a lot of fun talking with you guys. So
Absolutely.
Yeah, one thing I wanted to say is, you know, you guys touched on the chest pain accreditation, but that's probably one of the things I'm most proud of. I've been here almost 10 years now. When we first started, you know, everyone knew you could recognize a heart attack, you could read an EKG. I mean, but that process took, you know, 45 minutes, an hour maybe to get even EMS here. I'm telling you right now, and I'm very proud of this, almost every person that comes in that actually would be a STEMI or having an acute heart attack, we will have that recognized and on the ambulance within, well, our goal is 30 minutes, but we'll have them 15, 20 minutes sometimes. And that's, you can go across this state, I'm telling you, and we're probably the most efficient at doing that. So yeah. I'm very proud of our team because we've practiced it, we've drilled it through everyone's heads that this is what we need to do, and we're good at it.
Well, I agree. You know, we're part of the Gill Heart Network with UK, and you know, when we look at all the different metrics across all of their network, I mean, we stand out as a top quality provider here. So that is something to be really proud of.
I agree with that because, you know, it's like a lot of places don't have the teamwork efforts that we have together. Is
right.
When that STEMI comes through the door, as soon as y'all realize that you're calling us and we're over here standing and helping prep and get stuff ready to where we can get them loaded and gone and meet those times. It's important for us too, you know, that we can get in and out quickly.
Right.
Because all of us have increased in our call volumes. So we've made a plan that seems to be working, and that's working hand in hand with Dr. Haake and with Jamie to make sure that we have that.
Well, and the same with the stroke. I mean, I think that's also a cool thing because, you know, if you can get that thrombolytic or clot busting drug on board somebody sooner, then you're going to have a much better outcome.
Time is brain. So
that's right. Same with the heart muscle, right?
Absolutely.
Yeah. Well, I want to thank you guys, Dr. Haake, thank you, and Jamie and Freeman. I appreciate you guys joining me today, and more importantly, for the work that you do each and every day to protect and care for the people of Woodford County. Emergency services are often a safety net that we don't think about until we need them, but we're always here for people. And this conversation is a great reminder that having a local hospital, a responsive ER team, and a strong EMS partnership makes all the difference when time's critical. And Bluegrass Community Hospital, we're proud to be your local hospital, proud to be part of the community that shows up for one another in all times of need. And be sure to look for Bluegrass Community Hospital on Facebook and LinkedIn, and subscribe to Check Up with Bluegrass whenever you get your podcast, wherever you get your podcasts, so that you never miss an episode. And until next time, stay well, stay safe, and we'll see you soon.
Thanks.
Thanks, Dave.
Thank you.